Who in the world provides free dental treatments? Have you ever heard of such a thing? Now, I want you to think for a moment with me what it would be like to need dental work and not be able to afford it. My next guest is part of an organization that provides free dental treatments. Dr. Jeffrey Gardner, DMD, MAGD, and president of Donated Dental Services Leadership Council, South Carolina. Welcome.
Thank you very much. Thanks for having me.
It's great to have you on. And listen, I had to look up your title, okay? I said, well, what is DMD, MAGD? So would you kindly tell our audience what you specialize in?
Well, I am a general dentist. We do family dentistry. We do cosmetic dentistry. And, the other designation, the MAGD, is just part of a degree, if you will, that I've gotten through continuing education through the years of training. And it stands for the Masters in Academy of General Dentistry. And that's just one of the professional organizations that I'm involved with.
And in short, what I had been reading, you're so modest, but it was saying that less than 2% of general dentists in the U.S. and Canada have this title. So you come highly qualified.
Thank you.
So let's talk about the Donated Dental Services Program, or DDS. We'll call it DDS from here on out. But what is it and how does it work?
So the Donated Dental Program, like you'd mentioned, is a program that falls under the Dental Lifeline Network. And what this organization does is based out of Denver. And we're in all the states. And what we do is we provide free dental care for individuals that are permanently disabled, age 65 or older, or are medically fragile. And so this is all determined through a staff member that we have on board that does screenings once she gets the applications in. And she decides if, first of all, they meet the criteria for our program. And then at that point, we have a network of dentists throughout the state, as well as dental laboratories that are willing to see these patients. Currently in South Carolina, we have 205 dentist volunteers, and that's out of about 2,000 dentists in the state. And pretty much all of the dental laboratories are involved and willing to help with these cases.
How many approximate people might be waiting for services? You said there's how many dentists available?
So we have 205 dentists statewide. It would be nice to have twice that amount.
Exactly.
Because we do have individuals that are on a waiting list and are waiting for an opportunity for a dentist to see them. And most dentists that are in the program see one or two patients a year, maybe more, just kind of depending on their patient load. And several counties in the upstate, as well as down in the Beaufort area, we're in need of volunteer dentists.
What criteria is called for a dentist to be a part of the program?
So we actually have a campaign going on now called willyouseeone.org. And so the website for a dentist to become a volunteer would be www.willyouseeone.org. And the one is spelled out ONE. And we're looking for all types of dentists. We need specialists from time to time, but most of the dentists on board are general dentists that practice a wide variety of procedures within the dental field.
How long does the dentist stay in the program?
What we found usually is that our volunteer dentists that are involved, when they get involved, they enjoy treating patients within the DDS program, and they generally stay involved indefinitely, and most of the time until they retire. They tend to treat these patients to the point where they get the case finished. The patient has their smile and their healthy teeth back, and they generally keep them on for regular patients for regular cleanings.
What support services does DDS provide to the volunteer dentist?
In my opinion, the main support feature that the Donated Dental Service Group out of Columbia is they bring the patient through the application process. They walk them through the process. They do the screening. They determine that the patient is a candidate. And internally, the way it works is they give us the individual's information, not so much medical or dental, but enough of a health history and a history of the situation where the dentist can decide whether they want to treat the patient, and then we move forward.
Let me understand now, where are the treatments done? Where, if a person is in the program and they want to have the free services, where do they get it done?
Yeah, so that's an important part of this program, in my opinion. Most of the dentists that I know volunteer in some sort of outreach clinic, and whether that's an evening on their way home, they stop by and they do some sort of free dental clinic. And a lot of times that's in a clinic setting. I've done settings where there's an actual trailer set up with dental chairs. But the great thing, in my opinion, about this program is, as a dentist, I see this patient in my office. And if you talk about, it's always nice to cook in your own kitchen, where everything is. I think that's a huge benefit to treating a donated dental service patient in this setting, because everything just seems to flow just like a normal dental patient would. Referrals can go out to specialists that are also, also involved within the program.
Mm-hmm.
And then I'm also able to use the lab that I'm comfortable using.
Very good. Again, we're talking with Dr. Gardner. This is a great program for people in need, and then dentists. Anyone at the sound of my ear listening to this program, if you would like to be a part of this DDS program and donate your services, and nothing is really free. Nothing is really free. This is coming at the cost of generous people just wanting to share their talent with people. So let me ask you a question about the services that are provided. Do dentists pull teeth, or are they fixing teeth?
Yeah, that's a great point. So again, I don't mean to disparage emergency clinics. There's absolutely a place for emergency clinics within our communities where dentists are generally pulling teeth to get people out of pain. This particular program, we're fortunate enough as dentists to be able to fix the dentition. So we're not only pulling teeth. So if you can imagine being a dentist and wanting to help people, it is rewarding to get somebody out of pain, but it's even more rewarding when we're not only taking teeth out, but we're actually fixing the dentition back, where people get a smile and they get some dignity back. And so that's the beautiful part of the DDS program is we're not just doing extraction, we're doing a full complement of dental procedures.
Yes. And, what's really special is that you're helping the population of people who cannot afford it. And a lot of times when you get past a certain age, people just don't tend to really think about taking care of their teeth. But good oral care is very essential to your health, wouldn't you say?
Absolutely. It's a very important part of the elderly populations. Their social interactions, like I've always said in my practice, and it's a little bit blunt, but what I've said is, as you get older and you move into the 7th, 8th, and 9th decade of your life, you do less recreational activities, but the things you do, you eat, talk, and go to doctors, and you need teeth. It's a very important part of the digestive system. It's the beginning of digestion, and it's a big part of the medical health.
Absolutely. So let's go over this again. Calling all dentists in South Carolina. You are needed for a very valuable service. And those of you who are blessed to see a dentist on a regular basis, I want you to pass this information on. I have a general dentist. I actually had to have periodontal care recently, so I've seen that practice, and now I'm considering braces. So I know 3 dentist offices that I am going to definitely recommend you guys to. But for anyone who would like to be a dentist in your program and volunteer services, or people who would like to get more information about how they can become a patient, would you give them that information?
Yeah, so that's a great way to put it. So the dentist, we kind of try to pitch this program when we go to meetings and we're in a room full of dentists and everybody's busy and they get back to their office. And more than likely, if you could meet with them one-on-one, they would say yes, but life gets in the way, and a lot of dentists who it would and more than likely sign up for a program like this just fail to do it. So it would be kind of neat to have patients look up at their dentist and say, "Hey, I heard about this great program, and would you like more information on it?" And so the dentist particularly, could go to that willyouseeone.org. They could also find us through the dentallifeline.org website. But the Will You See One is basically a program that we're promoting nationally with a very famous dentist named Gordon Christensen. And what we're doing is we're asking dentists to just see one patient. And if they like the experience, if they feel like it flowed really well and they found some value in it, that maybe they could start a relationship with us and start seeing maybe one patient a year. If we could get South Carolina dentists, every South Carolina dentist, to just see one donated dental service patient a year, we would clear up all of our waiting list and we would have more volunteers than we needed.
Awesome. And for people who would like to be a patient?
For the patients, yes, dentallifeline.org/South Carolina. But if you just end up on dentallifeline.org, there's the icon of the United States map. Just click on South Carolina and you'll flow right into our process where you learn how to, it'll show you where to fill out the application. All
right. Dr. Gardner, thank you so much for your time. And thank you so much for this organization and what you guys are doing to help the community.
Thank you very much. Spread the word. Appreciate it.